A trauma team activation encompasses the involvement of multiple specialties, led by the emergency department. Hemorrhagic shock is often encountered in a trauma code, therefore, requiring fluid resuscitation and transfusion of blood components. The damage control resuscitation strategy is employed in major exsanguinating trauma to decrease morbidity and mortality. Part of the DCR modality emphasizes on hemostatic resuscitation with 1. Limitation of crystalloids administration, 2. Use of tranexamic acid, and 3. Early blood transfusion. Once a massive transfusion protocol is activated, the target is to achieve a close 1:1:1 ratio of packed red blood cells, platelets, and fresh frozen plasma. In a chaotic and understaffed ED, it is often challenging to monitor actual fluid administration and blood components due to 1. Reliance on manual documentation on patient's chart by ED staff involved hands-on in the trauma code. 2. Multiple orders from various specialties amongst trauma team leading to cognitive overload and incoordination during resuscitation. 3. Lack of visual aids during resuscitation and 4. Absence of electronic medical record. Inspired by the MTP scorekeeper used in US trauma centers, we devised a locally built electronic tracking board to display in real time administration of crystalloids, blood components, and vital medications in patients presenting with hemorrhagic shock. We collaborated with Chumbaka Kuching to build the electronic tracking board. Chumbaka Kuching is a social enterprise with the purpose of developing children's life skills by inspiring them to create with technology such as coding, game development, physical computing, and machine learning to overcome real-world problems. A team of 5, ages between 15 to 19 years old, was assembled by the co-founder of Chumbaka to develop and build the electronic board with the supervision of an educator. The development time took around 5 weekends with a budget of 370 ringgit.
So for the electronics and software of this board, we're using a microcontroller called an Arduino Mega. This allows us to program all the different features of our board and integrate or interface with our other electronics. Like we have these displays that can display 4 digits or 2 digits. So we're using the 4 digits for our timers, so like clocks, and then the 2 digits for our counters, so that we can keep track of like how much blood we're giving and things like that. And the Arduino also takes care of a lot of the buttons and the LEDs, and we're able to program all the logic inside so that all of the components work together with each other.
Introducing the Hemo-ShockED electronic tracking board prototype. Hemo-ShockED stands for Hemorrhagic Shock in the Emergency Department Blood Component Tracker. The Hemo-ShockED prototype is battery operated and can also be powered up via USB. Hemo-ShockED is designed to be portable with intuitive buttons reflecting the desired output of vital medications or blood components administered, thus making it user-friendly for all levels of ED staff. The aim of the Hemo-ShockED prototype is to allow 1. The whole trauma team to visualize clearly and keep track of transfusion ratios, limiting crystalloids, and ensuring vital medications are administered. 2. Smooths the resuscitation process by visual coordination and reducing cognitive overload. 3. Portability of the electronic board ensures proper handover when the patient is transferred out of the ED to the ICU or imaging suite. 4. As a tool for trauma audits to improve trauma care and patient disposition, example, patient length of stay in the ED. Future research needs to be conducted on the impact of the Hemo-ShockED prototype during trauma resuscitation. The incorporation of visual aids during resuscitation becomes crucial, particularly in the context of hospital overcrowding, facilitating more efficient patient management and improved patient safety outcomes.